When I first started in 1987-88, there was no vision science. There was Professor Archer and one or two researchers. I guess I was the first person from the medical fraternity to really take on research in a dedicated way. And then from about 2000, as our grant income rose and our publication profile rose, we were certainly becoming a very successful group within Queen's, and that's when we were granted the accolade of being called a Centre for Vision Science. We are undertaking world quality research now. We're out there with our peers. The URI study was a great collaborative effort across Europe. There were 7 centres in Europe that got together in 2001. We received a grant of several million euros. We undertook a study collecting data in exactly the same sort of way. We developed a lot of fantastic contacts in several countries, and that's led to more collaborative efforts and more grant income and publications. So it was a very, very exciting study to take part in, and the rewards have been huge. In the IVAN trial, we tested 2 drugs. A drug called Avastin, which is a very cheap drug, against a very expensive drug known as Lucentis. These 2 drugs do the same thing. They inhibit a growth factor called vascular endothelial growth factor. So there were 2 reasons for doing it. One was to show that the cheap drug worked just as well, and secondly, to see whether we can reduce the frequency of treatment. The patients who were enrolled in the trial had wet macular degeneration. You get these leaky vessels in the macula of the eye. So these were all elderly people, usually aged 65 and above. We enrolled over 600 patients in the 23 clinical sites in the UK. I was the chief investigator for the trial, but there was a large team of very experienced people from throughout the UK who took part. So what the trial told us was using Avastin, the cheaper drug, was just as effective as using Lucentis, the more expensive drug. These findings have only just become available and will be looked at by the Department of Health and by NICE. Each vial of Lucentis costs well over £500 now, and each vial or injection of Avastin costs only a few pounds. So the savings in drug costs are quite considerable for the NHS. We're very excited about the future because we've just received new grant income of over 3 million to undertake some research into the risk factors for development of wet AMD, and the Northern Ireland longitudinal study on aging is just about to take off. And in that context, we've leveraged over £500,000 worth of funds. So we're going to be building up a whole bank of people who go on to develop disease, and that's going to be a very interesting area to study. So there's a lot happening. We've appointed new staff. So really, there should be nothing stopping us from making some very impressive discoveries in the near future.